Thank you so much for connecting, and then you said that okay, menopause is an important topic we all should talk about. With such a short discussion, you thought that okay, for on Sunday I'm free, let's connect and let's talk about menopause. So my first question is, and it's a very very common sense question, is are there patients, women, are they even visiting to your clinic for perimenopausal or menopausal problems, and for what purpose they visit the hospital? Is there any awareness? What's your real world experience in this?
So basically what happens is, let's not even call them patients, because menopause is a natural phenomenon. Okay?
Yeah.
So they do come, but the issue being that because we are not aware of this transition which happens, because as you said, motherhood is so much focused upon in a woman's life. Be it hearsay, or be it, you see pregnant people in a family, we at least know a little bit. We are a little bit aware about pregnancy, pre-pregnancy, post-pregnancy stuff, but no one talks about menopause because it is not talked about. People don't know about it. So when these women come to me, they themselves don't know that it is, a natural transition which is happening. And there are particular things that they are supposed to happen. And that is why they come to me with various other symptoms. Okay. So like a woman will come to me with joint pains or irritability, or, they'll come with menstrual problems, doing cycles. So that is what is happening. And there are so many myths around menopause. So what menopause is? Menopause is aapki ovaries ne le liya retirement. Okay. So now, till when you were in the reproductive age group, your eggs were being released every month. And ovaries is what makes a woman a woman. Okay. The hormones, the estrogen and progesterone is why we have that particular figure and our skin and our hair and so we are women because of the estrogen and progesterone, and which is secreted by the ovaries. So now, after a particular age, in India, the average age for menopause is 47. So let's say around 46, 47, what happens is ovaries start getting a little lazy. Okay. So now, menopause never happens overnight. It is never like, kal kha, ab nahi hai. So what happens is the ovaries over a period of time start decreasing the amount of hormone which is produced. So what happens is आपके cycles थोड़ा सा late आने शुरू होंगे. So first it will be, the cycles will come, let's say 15 days late, and then a month late, and then 2 months and 3 months and 6 months. So once it's 6 months and beyond, that means now your cycles are not supposed to come. The myth around this is what people say, what is there in their mind is कि जब cycles जाते हैं तो extra bleeding होता है, the cycles will come sooner, there'll be a lot of bleeding, which is wrong. Because the ovaries are taking retirement, the bleeding has to reduce, and the frequency and the frequency is less, and the intensity of bleeding is also less. Anything apart from this is abnormal. So what happens is women stay at home thinking कि सब लोग बताते हैं कि ये तो normal ही है, bleeding थोड़ा ज़्यादा होता ही है, थोड़े cycles गड़बड़ होते हैं. Yes, but they are supposed to come later than what you expect them to, and the bleeding is supposed to be lesser than what it was. So if this is happening, you are entering into that zone. Don't worry. But the thing is that along with this, there are many other changes that are happening which are a little irritating. For example, the hot flushes and a little bit of weight gain, the rise in cholesterol levels, our bones getting a little weaker, okay, repeated infections, and lastly, let's not forget about it, the cancers which creep up. So these are the things that we need to, address basically.
So नहीं, उसके पहले एक छोटा सा क्वेश्चन पूछना है मुझे कि 47, if it is the age for average age for menopause, पेरीमेनोपॉजल टाइम जो रहता है वो कब से आप कंसीडर करते हैं?
That varies. And 47 is also what is the average Indian age.
Average.
We have women who are at 50 and still menstruating. These days, sadly, I have had people who at 40 are, menopausal, at 43 are menopausal. Like if you see now, the average age of puberty has also come down.
Correct.
We have earlier when, we were young, our menarche, like the first time we got a period, was around 14 to 16, 8, 9, 10 standard में जाते थे, तब जाकर के cycles आते थे. Now we get girls in 4th and 5th standard, tender age, बिचारा बच्चas, and they start menstruating.
True.
So what I feel is probably, humans are evolving and our brains are getting sharper. They are, so the hormone production is early. So since that is early, even the menopause is coming earlier. So the perimenopausal age group can be any time after, ideally, any time after 44, 45.
Okay. और जो मेनोपॉज का टाइम रहता है ऑन एन एवरेज व्हाटएवर, उसके कब कितने पहले से सिम्टम्स women they start experiencing the
6 to 8 months is when they start feeling those symptoms.
Okay. और जो ये है, so we'll if we can say that कि जो symptoms level पे जो है उस लेवल पे उन लोगों को क्या क्या मैनेज करना चाहिए. We'll get into the complications later. So अगर perimenopausal symptoms है या menopause
complications, Smita, this is all which is natural, but like most of the time, because people don't talk about it, they're not aware about it, they don't understand what they're going through. Okay, वो एक there's very पुराना हिंदी कहावत की बुढ़िया सठिया गई है. What is बुढ़िया सठिया गई है? Is basically now she's got menopausal and she's irritable and she's irritating. Now what they don't understand is it is not satya jana, it is your hormones which are playing the game. Your estrogen progesterons are going down and you get a little irritable, you get a little chidchida. So things that you were easily patient about earlier, कि ठीक है हस्बैंड ने टॉवल नीचे फेंक दिया है, वो जन्मों जन्मांतरों से वही चीज कर रहा है, ठीक है. So over a period of time you get used to it. But now you don't want to get used to it. You're like, uthao. You're like, why are you getting so irritated? This is something I've been doing for years, or the kids for that matter. So, the family will also be like, she gets irritated at trivial issues.
Correct.
Or the co-worker, or something like that. So the patience level goes down. So this is not, it's not a complication. It's just a transition, just a phase that you're in. Like premenstrual. People don't talk about premenstrual irritability, but it is there. I know it is there.
Yeah.
So many of us mask it, and some of us can't mask it, but for the people around. So that's how it is.
So if you look at I was looking at a couple of newer research that is happening in this area, which we don't need to discuss for a normal audience, that's specifically for probably the doctors. But if you look at the age group wise, 1/3 of our life, 1/3 of women's life, they are post-menopausal. Okay. Yeah. And there is not a single dedicated center for managing or clinically managing menopause in India. Even doctors, those who are there, they are and I'm so happy that you agreed to talk about this, because most of the obstetrician and gynecologists, they focus more on the reproductive health, they focus on babies or infertility related thing, and there are very few doctors those who have that kind of understanding and specialization. I'll tell you, like couple of days back I was talking to Dr. Anjali Bhatt from our college only, and she was talking about diabetes and all the perimenopausal or menopausal symptoms, and how psychologically they are not even aware that they are getting exposed to lifestyle diseases now. Their risk is higher, and and another very important thing she talked is self-worth, because unfortunately women's worth is with the baby related things, right? Like her existence and her self-worth is very much linked with the motherhood. Okay, and suddenly when she's menopausal, suddenly women think that कि मैं अभी क्या मेरी क्या जरूरत है टाइप वाली फीलिंग आने लगती है.
इंडस्ट्री बंद हो गई है, प्रोडक्शन बंद हो गया है, the factory should shut down.
Yeah, and that's actually a very sad part of it, क्योंकि आपकी 1/3 लाइफ बाकी है, और मतलब का सिर्फ 2 ही फेजेस खत्म हुए हैं और एक कंप्लीट फेज बाकी है लाइफ का. सो व्हेन दिस वुमेन रीच आउट टू यू, इसमें मेडिकल ट्रीटमेंट कितना आप मैनेज करते हो, एंड हाउ मच ऑफ द साइकोलॉजिकल ट्रीटमेंट यू नीड टू आल्सो गिव इट टू देम?
So it is all a mind game. Okay, it is how you perceive a particular phase. Okay, I mostly don't really give many medications, because till now for these perimenopausal and the postmenopausal symptoms, the major there are no major medical breakthroughs. Okay, most of the medicines are still under research. There was a phase in between when hormone replacement therapy was the in thing. Okay, but you learn and then you unlearn again. So hormone replacement therapy came with a lot of disadvantages and a lot of risks later on. So there were a lot of side effects. So these days, hormone replacement therapy is given in a very few selected cases. It's mostly counseling, lifestyle changes, and you need to make them aware and basically let them accept it and be happy with it. So what I generally tell my patients, अच्छा है ना विस्पर का खर्चा कम हो गया अभी. You can have sex without thinking about a pregnancy. You can wear a bikini suit without plan your vacations without thinking of your cycle dates.
Correct.
So in fact, life is now easier.
Yes.
So it's a perspective. आप कैसे देख रहे हो इस चीज को. And so it's just a phase, and you need to accept it and go along with it.
And it's a beautiful phase. I totally agree.
Because by then all your responsibilities are taken care of. Generally, kids are बड़े हो चुके होते, they're independent. So now you can have your girls gang, and you can have your trips, and you can make the most of life.
True. और best part about it is कि travel plan करते वक्त आपको सोचना नहीं पड़ेगा. Like that, I think that's the best part about menopause. You can travel whenever you want, and you can stay wherever you want, kind of a thing. Because with periods, when you're traveling, you have to see कि hotel hygienic हो, convenient हो, comfortable हो. बहुत ज़्यादा plan करना पड़ता है. Yeah.
And you can get into the swimming pool as and when you want.
True, there are definitely good part. And I think then what we are trying to say over here, that these are the symptoms that are there, and so much of material is available on internet. Only thing, we all need to start talking about it. Yesterday I was just asking one of my friend that I was researching कि क्या चल रहा है menopause related thing. आपसे बात करनी थी, तो I should study little more. And I asked like, तुम्हारे mother को भी कोई symptoms है क्या आजकल? So he was like, I don't know. Like usually we don't even ask her, or we don't even observe कि mother, मेरी mom को कोई symptoms हो रहे नहीं हो रहे ऐसे. या even खुद friend भी है, और my friends are there जिनके wives are into their late 40s and all. But if you ask them, they don't observe, right? Like we don't observe कि कोई changes है नहीं है करके. तो क्या क्या symptoms हमें देखने हैं और क्या क्या ध्यान रखना है कि ये तो होना ही है करके. तो hot flashes की बात कर रहे हैं हम लोग, और mood changes की हम बात कर रहे हैं. Skin dry होगी, hair थोड़े से thinning हो गए क्योंकि estrogen का effect जा रहा है. Weight gain हो सकता है थोड़ा बहुत. Irritability काफी रहेगी आपको. Sleep disturbances भी काफी लोगों को होते हैं because hot flashes की वजह से.
Yeah. Because of the hot flashes.
और कोई सिम्टम्स, और ये होना ही है, एंड देन वो थोड़े थोड़े दिनों में आपको उसकी आदत हो जाती है. दैट्स इट, राइट? लाइक
yes, the body gets used to the low level of estrogen progesterone over a period of time. और weight gain थोड़ा बहुत नहीं होता, अच्छा खासा weight gain होता है 5 to 7. So generally, when my patients come in their 40s, or even post delivery when they come, so I always tell them कि ना अभी 5-6 किलो कम करके रख लो, so that you can accommodate that 5-6 kilos which you're going to put on in your 40s. So then you don't have to worry about losing it, because तब तक ये भी हो जाता है कि our basal metabolic rate also changes. The stamina with which we can exercise, the dieting habits, बहुत जल्दी you cannot, at that age getting into them is a little difficult. Not that it is impossible.
Correct.
I know of women who are in 50s and who are excellent gym. They lift good weights, and they are fitness freaks, and they are biking, and they're cycling, they're swimming, and so that is always there. But so in that perimenopausal age group, once you cross 40, be very careful about your eating habits, and try to keep your weight as low in your in the whatever is acceptable norm range, so that when you put on that little excessive, you look beautiful, you look voluptuous.
ये और ये बहुत अच्छा चीज बताया आपने, क्योंकि हमें क्या होता है कि मोस्टली जब प्रॉब्लम शुरू होते हैं, जब तब जाके हम लोग सोचते हैं कि नहीं, जिम जाना चाहिए, अभी थोड़ा कुछ करना चाहिए. But though the perimenopausal and menopausal age is we are talking in 40s, but I strongly recommend, especially for the muscle memory, especially for getting your body used to the workout mode. Okay, strength training ये वगैरह बहुत जरूरी है. तो 35 is the right age to get absolutely into your fitness lifestyle. मतलब हर women को I will say, क्योंकि बाद में आप same weight कर रहे हो, same diet कर रहे हो, results बहुत कम आते हैं और बहुत slow आते हैं. Your metabolism works very differently.
और फिर ना तब क्या हो जाता है, when you don't see those results, your confidence level goes down. And then you are a little disappointed. फिर लगता है यार क्या कुछ. So that these women who come to me, कुछ होता नहीं है madam, कुछ नहीं. And then this other misconception, now this is not menopause, but since we're talking about gym and workout, there are so many people will come and ask me, ma'am आप कह रहे हो कि gym join कर लो, workout करो. और हमने सुना है कि जब छोड़ देते हैं तब weight gain हो जाता है वापस से. So I always tell them कि दारू थोड़ी है, छोड़ो मत ना. It's way of life. Continue it. It is a good habit. Why do you ever want to leave it?
True.
And, it's a good life.
Again, it's a absolute myth, क्योंकि अगर weight gain हो रहा है तो इसका मतलब आपका डाइट फिर से वापस आ रहा है जो पहले खाते थे आपका, और कैलोरी बर्न नहीं हो रही है आपकी, क्योंकि जो हो रही थी वर्कआउट की वजह से, तो वो इट्स नॉट कि वर्कआउट चेंज करने की वजह से आपने बंद करने की वजह से वेट गेन किया है. सो व्हाट वी आर सेइंग इसकी सिम्टम्स है, बट सिम्टम्स आने तक वेट मत करिए. तब जाके अगर आप क्विक फिक्स करने की कोशिश करोगे तो और ही ज्यादा होने वाला है. आप पहले से समझ लो ये तो होना ही है और पहले से प्रिपेयर करना शुरू करो. एंड आई थिंक दिस प्लानिंग माइंडसेट जो रहता है, दैट इज इम्पोर्टेंट फॉर एवरी स्टेज ऑफ लाइफ. अगर आप बेबी प्लान करने का बाद में सोच रहे हो तो आप पहले से. और एक बहुत अच्छी चीज मुझे अगेन डायबिटीज रिलेटेड ये किया था कि इफ यू आर इनटू द रिस्क फैक्टर फॉर डेवलपिंग डायबिटीज, अगर आपकी फैमिली में है और ये, तो बेबी प्लान करने के पहले ही आप स्क्रीन कर लीजिए, प्रेगनेंसी के बाद ना करिए. ये बहुत अच्छी चीज हमने उस दिन विमेन हेल्थ के रिलेटेड डिस्कशन में डॉक्टर अंजलि से सुनी थी. So similarly, like for menopausal symptoms to occur, ठीक है, जब तक सिम्टम्स आते हैं तब तक वेट मत करिए, और तब जाके उसमें ये मत कहिए कि चलो मैं अब जाके लाइफस्टाइल चेंज होगी करके. दैट्स व्हाट वी आर टॉकिंग हियर. सो नाउ कि ठीक है, ये है एस्ट्रोजन का प्रोटेक्शन शील्ड निकल गया है, आपने एक्सेप्ट कर लिया है कि ऐसे ऐसे है, सिम्टम्स पता है, यू आर टेकिंग इट काम, यू आर टेकिंग इट गुड, यू हैव अ गर्ल्स गैंग, यू आर प्लानिंग योर ट्रैवल, ऑल दैट. कॉम्प्लिकेशंस क्या होते हैं? नाउ यू डू नॉट हैव एस्ट्रोजन, अब क्या होता है बॉडी के साथ?
Yes, there are these 3-4 which are very common. Let's not talk about cancer. I think you all have already spoken about cancer, and which is like a terminal thing, and that's a different ball game altogether. I'll talk about the day-to-day stuff that happens. Okay. Number one of them is urinary complaints. Okay, खांस लिया, सुसु निकल गया, clothes are getting wet, urine control नहीं हो पा रहा है. This is one very common, and a very annoying thing that happens. Now, obviously, you're planning a girl's trip, you're laughing away to glory, and suddenly you wet your pants. So that is not something which, any one of us would like to. Now, trust me, this thing should be ideally taken care of post-delivery only. But generally, India में ना अभी तक वो post-natal exercises का importance, people don't talk about again. भाई, production खत्म हो गया, अब fact की इतनी जरूरत नहीं है जब तक अगला प्रोडक्शन शुरू नहीं होगा. So people don't take their supplements post delivery, they don't look after themselves. What happens is, anytime because of the delivery process and because of the labor process, what happens is हमारे जो pelvic floor muscles हैं वो ढीले पड़ जाते हैं. Okay, अब वो थोड़े से ढीले हैं ही हैं, प्लस मेनोपॉज आया, थोड़ा सा वेट गेन भी हो गया, as I said, plus pelvic floor muscles in general become a little lax at this time. तो जो यूरिन कंट्रोल का जो फिनोमिनन होता है, that becomes a very, that goes a little haywire. So what happens is, then these things start. Number one, repeated urinary tract infections. Again, because जैसे यहाँ की स्किन ड्राई और थिन हो रही है, wrinkles आ रहे हैं, वैसे ही your vaginal mucosa and the urethral mucosa and stuff there also becomes a little susceptible more to the bacteria. Okay. Now, again, when, women are traveling, what happens is we have this innate, urge within us not to drink water when we are traveling. Do you do that, Smita?
Yes, I totally do that.
Yeah.
Because we don't know कि washroom available है नहीं है, clean है नहीं है, so we don't drink water for sure.
Everyone does that.
Yes.
But that is wrong. Okay.
I know that.
We need a full bladder to flush out if there is any urge. Now, let's take a simple example. If I'm supposed to travel from Nasik to Bombay, which on an average takes 4 hours. Okay. I have not taken any water. Okay. My bladder is going to remain empty, which doesn't. कहीं तो भी पूरी ठाना आते आते मुझे सुसु लगता है. Okay. Now I'm going to use a public toilet, but I have to. Okay. And now, since my urine is concentrated, and let's say वहाँ का vaginal mucosa is also a little thin, I am at more of a risk to catch an infection.
True.
So drink lots of water. That is very important. For women, I tell them it's going to keep your skin and hair healthy. So that is, the thing chocolate mein wrap karke I give them. So take 3 liters of water a day so that you don't land up into urinary tract infections. Make sure that you use hygienic places for peeing. These days there are stuff like pee cups and all available so that you don't really have to touch of the toilet seat. If possible, use in toilets so that again that there is a little lesser amount of infection risk involved over there. And if nothing is possible, I tell them use Mother Nature. If your toilet is not clean, stop the car somewhere, go to the jungles, enjoy the sea, relieve yourself and come back. But they don't do this thing of not having water. Okay. That is one thing. The other important thing is Kegel's exercise, which I feel gym workout is important. After 35, should be doing these Kegels exercises, which are pelvic floor exercises. Very easy to do. It doesn't take a lot of time. They're very simple. They're available all over YouTube, Google if you search. But I'll tell you what are basically. You just have to, pull in the pelvic floor muscle. आपके यूरिन और पॉटी की जगह के आजू बाजू के जो मसल्स हैं, take them in 1, 2, 3. So this has nothing to do with breathing. इसमें कोई tummy नहीं है. As of now, as I'm talking to you, I'm doing the exercise inside, so it is not visible from outside. Okay. True. Once you do it, it generally takes 3 seconds. So you pull in 1, 2. But then this should be done around 200 times a day. So that is a catch over there. So आप अपना favorite reel देख रहे हो, आप सब्जी काट रहे हो, you're just chatting out with your friends, you're over the phone, you're, reeling, whatever you're doing, you can do this, but that is going to be huge savior later on. Correct. Kegel's exercise is not solving your issues, then definitely you need to meet your gynaec or your urologist or someone to make sure there's nothing more abnormal going out over there. So this urinary thing is one more problem which women at this age suffer from.
Correct. इसमें 2 चीजें मैं ऐड करूंगी आप जो बता रहे हो. One is regarding the पानी नहीं पीना and then not so available washrooms and everything when you are traveling. जो पी बडी टाइप के जो अभी आए हैं, these are things, they are wonderful. I'm going to create a video about it, that it is really convenient. और especially अगर आप even dinner को जा रहे हो, party को जा रहे हो, कहीं पे भी, तो भी it is so convenient to use it, and it's a wonderful product. They got it into the market. काफी अच्छा product है. Second thing is जो आप pelvic floor exercises को वो बता रहे हो, वो बहुत आसान है करना. मतलब आप बैठे बैठे कर रहे हो और एक आदत पड़ जाती है ना. जैसे यू रिमेम्बर जब बाबा रामदेव का वीडियो बहुत फेमस हुए थे, तब एयरपोर्ट पे सब लोग यूं करते रहते थे कि इससे हेयर ग्रेइंग नहीं होगी करके. और आप अगर एयरपोर्ट पे देखो, सब लोग यूं कर रहे हैं क्योंकि उस टाइम पे वो बहुत फेमस हो गया था. सिमिलरली आई थिंक वी ऑल शुड टॉक मोर एंड मोर अबाउट दिस पेल्विक फ्लोर एक्सरसाइजेज जो आप एयरपोर्ट पे वेट कर रहे हो कर सकते हो. फ्लाइट पे बैठे बैठे वैसे भी कुछ करना नहीं है, वहां पे कर सकते हो. आप ट्रैवल करते वक्त सब्जी, टीवी सीरियल, वो हर टाइम पे आप कर सकते हो. और इट इज सो बेनिफिशियल एंड इट्स रियली गुड फॉर एवरीथिंग. वन इज आप यूरिनरी ट्रैक इन्फेक्शन के लिए बताया, इवन योर सेक्सुअल हेल्थ रिलेटेड थिंग्स, राइट, उसके लिए भी काफी यूजफुल है वो एक्सरसाइज.
Talk about, which is again a very, you complete your sentence then we'll come to it.
नहीं, बस ये 2 चीज मुझे ऐड करनी थी. आपने जो बताई, जो आप बता रहे हो इतना यूजफुल है वो. तो यूरिनरी ट्रैक इन्फेक्शन काफी ज्यादा है एंड यू आर आल्सो टेलिंग कि उसको कैसे हैंडल करना है करके. नेक्स्ट क्या प्रॉब्लम होती है जो बहुत कॉमन है?
So yeah, about the sex life, just this mentality कि बच्चे हो गए. So I have 38-year-olds coming into my clinic, 40-year-old coming into my clinic and saying, and I generally have this habit of asking, because people don't talk about it. It is considered as a taboo, which it shouldn't. It is like it's a natural need of. In fact, people say you be naughty at 40, right? Naughtiness should increase. So, but the thing is, people don't want to talk about sex, and especially उनका यही होता है कि बच्चे हो गए मैडम, अब बच्चे बड़े हो गए. And now what is the need? But no, it is not like that. Sexual health is important. It is important for a couple to keep them bonded also. And there are these natural hormones that stress that, is built up, the sexual stress that needs to be taken care of. So many times what happens, the women don't talk about it, but, when the husband comes along, so then he'll be like, madam, ab to inko koi interest hi nahi hai. And, she gets at the touch also, and we don't know how to handle this, and we don't know how to go. So one major reason why this happens is because of the vaginal dryness again, because the levels are going down. Baki about not being in the mood again is a mind game. Okay, so that needs to be counseled about the vaginal dryness. There are a lot of vaginal, jellies available which can help you relieve the vaginal dryness. There are some estradiol creams which can be used sparingly, of course, because they are hormonal creams. Do have a wonderful effect, and the couples should, now this is in between. This is a couple chemistry where they also put in a little extra effort during this age to be able to continue with their sexual life. Now here the husband comes in more, because a lot of foreplay, and again getting into the mood, making sure that your woman is comfortable does come into play. These things need to be taken care of, and sex life should end because you are menopausal.
Correct. और ये भी काफी myth है कि once you are menopausal, after your menopause, your sex drive will go down automatically. But वो अभी तो कुछ भी prove नहीं है. There is no research that completely says that. Of course, you are in a bad mood.
Think about it that way. So it is as we always say, sex is meant for reproduction. So अब वो part खत्म हो गया, तो now this part of the life ends. No, it doesn't. It doesn't.
Yeah, it doesn't. It doesn't end for men. And that's why it doesn't end for women as well. Like it doesn't end for anybody.
Correct. Not only procreation, it's recreation as well.
True. So we talked about two very, very common problems. One is urinary tract infection that can happen, or how to take care of that. You also so nicely explained कि sexual requirement needs as well as उसके related problem vaginal dryness और उनको कैसे handle करना है. And any other common problem that happens as this?
Osteoporosis is a very big issue this age. So, to be put very lightly, what happens during the reproductive age group is because of the hormonal profile. Let's say these bones are our calcium banks. ठीक है, तब saving चल रहा होता है. ठीक है, first comes अब you are debiting out of it. उसमें से you're getting out of. So basically, what happens is the bones get weaker. Again, working out does help the bone strength as well, and you need to be very careful with your calcium intake. So I generally advocate calcium supplements post 40. तो बड़ा मिथ होता है लोगों में कि मैडम इससे तो वेट गेन हो जाता है कैल्शियम से, और किडनी स्टोन तो नहीं हो जाएंगे. This is wrong. Number one, the amount of calcium, even if you're taking a supplement, trust me, we are still on the lower side of our calcium intake. Generally, India में 2-3 बच्चे होते हैं. So, जैसे मुन्ना भाई, we know 200 bones on an average, 200 to 400 आपने बनाए हैं. Women don't take calcium supplementation post delivery. कितना भी भौंक के बोल लो, they are not going to listen to it. So women in India are always calcium deficient. So a little extra calcium is only going to help. So calcium and vitamin D supplements should be taken. Also, your diet should contain jitna bhi possible hai calcium. India is basically not a very large, it's not a largely meat-eating population. So we are always low on, vitamin B12 and D and calcium and iron. So this is a time where consciously, I think once a year, a health checkup hona chahiye, where you get all these. So जब तक ना हमको वो levels दिखते नहीं है, we don't work on it. So if I blindly say my patients की B12 ले लो, वो दवाई का खर्चा, टेस्ट के खर्चे से कम है. The test is expensive. The medicine is very cheap. But they'll want a report. नहीं मैडम वो देख लेते हैं. ठीक है. But then this is important that so milk products, figs, walnuts, all these things should be inculcated in your diet.
Correct. So calcium ka, during the baby, when you are pregnant, आप iron, calcium, folic acid इतना religiously लेते हो कि एक भी tablet miss नहीं करते हो. Similarly, once you are into the perimenopausal age, it's important कि आप कैल्शियम की टैबलेट डेफिनेटली दो. और मैं इतनी सारे वुमेन से बात करती हूँ और मैं पूछती हूँ कि आप मिल्क पीते हो, कैल्शियम की टैबलेट लेते हो. आज तक मैंने किसी को नहीं सुना कि बोले कि लेते हैं करके. और ये जो आप बोल रहे हो, जो मिथ है कि कैल्शियम से स्टोन्स हो जाते हैं वगैरह, one my personal experience, and this is again no research proves that, बट वन माई पर्सनल एक्सपीरियंस इज कि कैल्शियम के डिफरेंट काइंड ऑफ सॉल्ट्स आते हैं, या फिर जिससे आप प्रोक्योर करते हो कैल्शियम, वो बहुत बहुत तरीके के फार्मेकोलॉजिस्ट, राइट, वही जो है वो रहता है। और आपको ये देखना है कि कौन से कैल्शियम आपको बहुत ज्यादा कंफर्टेबल है, कौन से कैल्शियम से आपको ऐसे लग रहा है कि आई एम नॉट हैप्पी विद दिस, या कुछ पानी कम ज्यादा पिया तो पानी कम पिया तो कुछ है। तो फाइंड आउट द सॉल्ट दैट मैचेस यू, आप पढ़िए उसके ऊपर क्या लिखा है, कौन से टाइप का कैल्शियम सॉल्ट है, एंड देन डाइट में तो बहुत ही जरूरी है। दीदी एक आपको एक ना बहुत अच्छा रिसर्च मैं बताती हूँ, विच इज आई विल सेंड द लिंक एज वेल। स्ट्रेंथ ट्रेनिंग जो रहती है, बिकॉज यू आर इन फिटनेस, strength training is found to be very much beneficial. The weight training basically very much found to be beneficial to delay osteoporosis. Okay, या changes of osteoporosis जो है, क्योंकि जब आप weight लेते हो, it is muscles are pulling your joints, और वहां पे it is actually also challenging the bone to stay healthy. तो women those who think कि weights नहीं उठाने चाहिए, उन्होंने weights definitely करने चाहिए. After 35 you are getting into workout, तो वेट ट्रेनिंग डेफिनेटली कीजिए. आई लव वेट ट्रेनिंग, इसलिए मैं ये आई एम टेकिंग दिस एज अपॉर्चुनिटी टू डिस्कस दिस. ठीक, सो कैल्शियम का आपने बताया, और कोई कॉमन वाले हैं बिफोर वी गेट इनटू लिटिल लार्जर कॉम्प्लिकेशंस, और कोई कॉमन सिम्टम्स है जो आप बताना चाहते हैं?
No, I guess these are the major symptoms. Cholesterol levels, yes.
जी.
So, estrogen is supposed to keep the cholesterol levels low. So, जैसे weight भी gain होता है, वैसे your blood cholesterol levels also tend to increase. So, till the time menopause happens, women are by and large at a lower risk of heart diseases compared to men, because we don't have estrogen, and we do. So, we are protected by the estrogen. Once this field is gone, our cholesterol levels tend to get a little higher. The hypertension and heart diseases tend to creep in. So again, diet is one major thing that needs to be taken care of. Now, no oily stuff and no kachoris and samosas. ध्यान से खाना ये नहीं कर दो. But yes, we need to be a little mindful about what we are eating. Regular exercise, lot of water, and then there are these few, अपने ही खाने में Indian food is awesome. I'm telling you, the changes in your food here and there will actually help lowering cholesterol. Like these days, there's a lot of talk on flax seeds, okay, garlic and walnuts. These reduce cholesterol levels naturally. So if you can, flax seeds ले लो आप, थोड़ा सा उसको सेक लो. हाँ, उसको फ्राई मत करो. एक बार सब्जी में आपने गार्लिक कट करके डाल दिया, उसको आपने तेल में फ्राई कर दिया, खत्म, उसका केमिकल कॉम्पोजिशन इज गॉन. सो आइडियली यू सपोज गार्लिक, एक जो कली होती है कच्चा, तो ताकि लोग भी दूर रहेंगे, कोलेस्ट्रॉल भी दूर रहेगा. बट नॉट पॉसिबल. व्हाट आई जनरली टेल माय पेशेंट्स इज, थोड़ा सा फ्लैक्स सीड्स को आप सेक लो, उसमें एक गार्लिक करके डाल दो, एक कोर ऑफ रोटी के साथ में आप उसको खा लो, देन ब्रश योर टीथ एंड देन
करेक्ट
दैट दीस थिंग्स हेल्प.
यस, एंड जो इसके जो आपने जो अभी सारी जो लिस्ट बताई, गार्लिक, फ्लैक्स सीड्स, वॉलनट्स, और जो व्हीट का ब्रांड रहता है, जैसे आटा हम मोस्टली बहुत ही रिफाइंड फुल के सुंदर दिखने के लिए खाते हैं, लेकिन जो उसका खरदरा पार्ट रहता है जो निकलते हैं, उसमें सबसे ज्यादा न्यूट्रिएंट्स रहते हैं. तो along with all your that helps for the cholesterol management, it also has your phytoestrogens, which helps you, क्योंकि एस्ट्रोजन वैसे भी कम हो रहा है, which you can get it from your diet. उससे आपके बहुत सारे, मतलब हाँ, बट ऐसे नहीं है कि वो दवाई की तरह अब शुरू करने हैं. आपको नॉर्मली भी डाइट में ये सारे इंक्लूड होने ही चाहिए, ब्रांड इंक्लूडेड होना चाहिए. इसीलिए मुझे लगता है कि जवार और बाजरी जो है वो ऑलरेडी उसमें रहता ही है. वी डोंट लाइक मेक इट लाइक अ वेरी रिफाइंड फुल के आउट ऑफ इट. जी, और वॉलनट और ऑल काइंड ऑफ नट्स आर सो इम्पोर्टेंट. एंड देन फ्लैक्स सीड्स तो मुझे लगता है कि आप पानी में मिक्स करके इफ यू जस्ट ड्रिंक इट एज वेल इन द मॉर्निंग, वो भी एक अच्छा एक ये रहता है.
Yes, definitely. And soya bean, I would like to talk about.
So yes,
that is one more, so phytoestrogens, since you were talking about phytoestrogens. So soya advocate in the form of nuggets ले लो आप, या तो जनरली सोया को अपने रूटीन जो आपका बीज फ्लावर है उसमें मिक्स कर दो, so that you are having it like on a daily basis and you don't really have to work अलग से take soya in your diet. That really
करेक्ट. आपको याद है हॉस्टल में वेंसडे को सोया चंक और मटर वाली सब्जी बनती थी?
And I then, but now since I'm into fitness, I am having it. So the other day I was remembering.
आप वेजिटेरियन हो इसलिए?
Yes.
Okay. क्योंकि सोया, those who are vegetarian उनको पसंद आता है, those who are non-vegetarian we are happy with fish and chicken.
I understand.
ठीक. Now we are talking about one small thing is that there is no protection of the estrogen. Of course, with plant and good diet and exercise or hydration, in सब की वजह से काफी आपको फायदा हो सकता है. Now let's talk about heart diseases, right? कि हमने देखा कि अभी एक फिल्म स्टार थे, उनको like अभी recently heart attack हुआ था. Women are also very much exposed to that. A couple of researches which one of my team member, Dr. Sosha, she was sharing with me, that more women they die because of stroke compared to men. More women they die because of heart attack compared to men. Not because कि heart attack उनको अलग से हो रहा है कुछ, क्योंकि they don't realize their symptoms and they don't reach to the office early. जो self care वाली जो बात होती है, उनको लगता है कि हाँ ठीक हो जाएगा करके, and they don't even reach to the office hospital early, और उसकी वजह से उनके chances of survival कम हो जाते हैं. तो heart health के बारे में आप पेरीमेनोपॉजल पोस्ट मेनोपॉजल इसमें आप क्या कहना चाहते हो?
Basically what happens is, as I always say, women are more tolerant. Okay. Works for them in most areas of life, but this is where it doesn't work for us. हम लोग सोचते हैं हो जाएगा, थोड़ा से तो दर्द है, एसिडिटी होगी. No. And again, like this applies everywhere, but mostly in case of heart and cancer, is prevention is better than cure. So yeah, I always stress on the fact of a yearly health checkup, because before you there is always nature gives us the time limit of before you reach there. So as I said, estrogen is helping your heart, is covering your heart, is protecting your heart, because we know that a lot of heartache otherwise women go through. So वो ध्यान रखता है कि नहीं बेचारी को ठीक बहुत already परेशान. But when you are into menopausal age group, that protection is gone now. So now you need to take care of yourself. So exercises, lots of water, जो हमने कोलेस्ट्रॉल लोवरिंग चीजें बताई हैं, बेसिकली इट इज ऑल अ गेम ऑफ कोलेस्ट्रॉल. आपके ब्लड वेसल्स को अंदर से वो कोलेस्ट्रॉल बंद कर देता है, ब्लॉकेज कर देता है, आपके हार्ट को ब्लड सप्लाई नहीं मिलता है, आपके ब्रेन को ब्लड सप्लाई नहीं मिलता है, एंड दैट इज वेयर यू go down you roll down. Hypertension, diabetes again. So these are the things that creep upon in this age group also, and because of the lower estrogen. So get yourself checked up every yearly. Generally, I tell my patients anniversary वाले दिन जाओ, because what happens, we think कि हाँ साल में एक बार तो हो ही जाता है, कब we forget the count. Always better कि एक दिन कोई तो भी decide कर लो, या 1st January चले जाओ, या decide on a birthday or decide on a anniversary date, a particular date. Go get yourself checked. No matter how fit you think you are, there is always something to make, but we are always, ignorance is bliss वाला फंडा होता है. So people are like, वहां जाएंगे तो कुछ तो भी निकल के आएगा. But that is the point of going. कुछ तो भी जो निकल के आ रहा है, we need to treat that. So I think that, and lifestyle changes, as I said. But what I've noticed is this generation of ours, especially Smita, we are better than our previous generation. A lot of women being more conscious about what is happening and taking care of themselves and getting into fitness regimes. In my gym, I see women who are 55 and 58 coming and doing whatever bit they can. Not that they're very good at it, but they're leaving that self-consciousness. So yesterday I was talking about someone, and they said that girls who come to the gym are stronger girls. So the fact, India mein wo jo ek, there's this tabby talk even now, around ki yaar wo thoda sa tight dress pehenna padega, there'll be men around. So the fact that a woman is sitting there in itself is showing that we are progressing in the right direction.
Correct. So ये जो इसका ना आपने जो कहा कि एनुअल चेकअप, इफ यू लुक एट लाइक अगर यूएस में देखते हैं तो अगर देयर आर बाय डिफॉल्ट प्रोटोकॉल्स हैं उनके कि आपको एनुअल चेकअप करना है, कैंसर अर्ली डिटेक्शन के लिए आपको स्क्रीनिंग करनी है. इन इंडिया वी ट्राई टू डू इट ऑन आवर ओन. देयर आर कपल ऑफ पॉलिसीज दैट आर देयर, बट अदरवाइज सो आप जो हैक बता रहे थे, आई फॉलो दैट. जैसे मेरा बर्थडे जैन में आता है, तो दिसंबर आई मेक श्योर कि मैं दिसंबर में मैंने ये किया है कि बिफोर आई गेट इनटू द न्यू ईयर एंड माय बर्थडे एंड माय न्यू ईयर फॉर द नाउ टू लुक फॉरवर्ड, दिसंबर में आई गेट माय एनुअल हेल्थ चेकअप डन. और इंश्योरेंस के थ्रू तो होता ही है, बट अदरवाइज आई मेक श्योर कि मैं दिसंबर में करूँ. फिर रिपोर्ट्स वगैरह आ जाते हैं, देन आई नो कि अच्छा ठीक है सब ठीक है करके, तो देन आई एम रेडी फॉर माय बर्थडे. So I do this and it works so good because then you don't have to remember कि कब करना है कब नहीं करना है करके. So once in a year works perfectly fine. और फिर ये भी नहीं रहता कि न्यू ईयर पे बर्थडे पे कर रहे हैं, एक महीना पहले कर लो, क्योंकि बर्थडे को किसको पसंद आता है हॉस्पिटल में जाके करो करके ना.
Next time I'm going to tell this to my patients.
I do this. तो ये मेरा ritual है, which I think it's really important. And then of course all the preventive measures, right? एंड आपने बहुत बहुत इंपॉर्टेंट चीज कही कि अगर हार्ट पेन है या कुछ एसिडिटी टाइप का फील हो रहा है और आप अगर पता है कि आप पोस्ट मेनोपॉजल हो और वहां पे आपके हार्ट डिसीज की रिस्क इंक्रीज हो जाती है, तो मेन इफ दे हैव लिटिल डिस्कम्फर्ट वो हॉस्पिटल पहुंच जाते हैं ईसीजी कराने. ऐसे सिमिलरली आई थिंक हमने भी वैसे बच जाना चाहिए, डिवाइन इन डिफरेंट सेंस, ऐसे कि थोड़ा बहुत डिस्कम्फर्ट है पहुंच जाइए, बस एक ईसीजी करानी है और कुछ नहीं कराना है, देखना है एवरीथिंग इज फाइन, नहीं है तो बोलना एसिडिटी की दवाइयां लेके वापस आ जाओ, जो मोस्ट ऑफ द मेन दे डू, लेट्स स्टार्ट डूइंग इट करके. लेकिन सिम्टम्स अपने अपने इग्नोर ना करे, हॉस्पिटल पहुंच जाए, एक ईसीजी कराना ही है बस और कुछ नहीं, बट यू जस्ट हैव टू बी सेफर कि कुछ नहीं है सब सही है करके, उसके लिए पहुंच जाइए, इग्नोर ना कीजिए. So अभी एक छोटा सा लास्ट एस्पेक्ट जो है, अगेन इट्स द सेल्फ वर्थ. जो वी कैन कीप टॉकिंग अबाउट कॉम्प्लिकेशंस, डिसीजेस, ये क्या क्या हो सकते हैं, एंड आई थिंक यू हैव कवर्ड मेजॉरिटी जो हमें उनको ध्यान रखना पड़ेगा. जो एक विमेन जो है, all if you ask anyone to start working out or take care of yourself, have a great diet, पानी भी पियो, स्लीप अच्छी लो, ये सब अगर ये करते हैं तो दैट इज एसोसिएटेड विद द सेल्फ वर्थ, राइट? इफ आई थिंक दैट आई एम इम्पोर्टेंट, then I put efforts for myself. If I think that I need to love myself, then I put efforts for myself. तो ये जो स्पेशली जो ये पोस्ट मेनोपॉजल एज ग्रुप की लेडीज है, उनमें वो अचानक से कम हो जाता है सेल्फ वर्थ जो रहता है वो. तो व्हाट डू यू से, लाइक हाउ दे शुड मोटिवेट देमसेल्फ, टेल देमसेल्फ, और सेल्फ टॉक करनी है या कैसे करना है दैट यू एक्चुअली अंडरस्टैंड, ओके दिस इज माय टाइम and this is now I'm going to live in a different way.
Smita, actually, again, this aspect of womanhood is something that you cannot inculcate into someone. It has to come from within. I'm very glad that these days there is a lot of content on self-love in general. Not only men, I mean, it's just there. If you open Insta, Chopra is talking about it, and Sushmita is talking about it, and Deepika Padukone is talking about it. There are so many, these counselors who are talking about it. So it's already there. Okay. And I think this area, your friends will help out a lot.
Yes.
So you have a good inner circle for yourself, which motivates you and supports you, because each one of us has that low day. Okay. Each one of us has that high day. So you need to have a balance out over there, and you need to have that inner keeps telling you. And also it has to come from within us. Okay? Yeah, beings, come on. And we are vines. We get better with age, and we are evolving so well. We are becoming so beautiful by the day. We're getting mature. We have learned so many things throughout our lives, and now it is time to put all of them into use. So
correct.
This is the best time, where you are still not dependent on anyone, like physically wise. Can do your own stuff, and we have the maturity of what to do and what not to do. So make our own choice.
Correct. And so nicely you explained this, that it is within, right? Like, our friend circle is so important. My daughter, now I'm worried that she'll get into teenage and she'll focus more on friends. And then I was trying to explain her कि friends तो बाद में भी रहते हैं. And then I was actually talking to myself, and I was listening to myself what I was trying to explain कि जब मैं कॉलेज में थी और जब मैं in my 20s, मेरे लिए फ्रेंड्स इंपॉर्टेंट थे और फ्रेंड्स ही ज्यादा इंपॉर्टेंट थे. लेकिन अब मुझे मेरे फ्रेंड्स ज्यादा इंपॉर्टेंट है, क्योंकि the kind of support system they give me, and then still same college के hostel के friends ही है जो अभी भी साथ में ही है, but the now I'm more connected to them, because anything that I feel, I know that they are there. I reach out to them, ऐसे हो रहा है, ऐसे feel हो रहा है करके.
Non-judgmental people, basically.
जी. So, and your social circle is very important, and we know that ये तो बहुत ही again proven है कि अगर if you are into a good community, good society, and you have a good social circle, it will keep you happy. You'll live longer and you'll be healthier. ये already वो इकिगाई book वगैरह तो सारी दुनिया पढ़ चुके हैं, तो उसमें यही सिखाते हैं कि आपके friends और आपकी community कितना important रहता है करके. So that's also very, very nice point you said. Though no matter how much we say that we are independent and we take care of ourselves, all these things, men in our life is also important counterpart, whether आपका बेटा है, आपके भाई है, फादर है, या आपके हस्बैंड है, आपके पार्टनर है, बॉयफ्रेंड है, जो भी है आपके, वो बहुत अपनी लाइफ का काफी माइंड स्पेस भी ले लेते हैं और लाइफ भी ले लेते हैं, मतलब है वो. व्हाट मैसेज यू वांट टू गिव इट टू देम कि इन मेन इन द लाइफ ऑफ ऑल द वुमेन, उनको क्या मैसेज देना चाहते हो, स्पेशली कंसीडरिंग द मेनोपॉज दैट वी आर डिस्कसिंग टुडे?
Be sensitive enough. And keep a gap between listening and responding. That will solve so much of problems in everyone's life. This goes along for women also. Generally, जब हम कोई बात सुनते हैं, we react. No, we need to respond. So keep a gap and try to be sensitive. We don't want men, to be understanding everything that we go through, because they can't. But just a little sensitivity, just a little patience is, I think, will be the key to a happier relationship.
Yes, and I think it's important for everyone, right? Like अगर आप बेटा हो और आपकी मम्मी है और आप देख रहे हो कि वो थोड़ा बहुत इरिटेटेड है, ये है, I think men should also start reading कि क्या symptoms है, क्या हो रहा है, क्या complications हो सकते हैं, and then be little sensitive. Just see, जैसे आपको सर्दी भी हो जाए तो मम्मी तो देखती है कि क्या हो रहा है करके, वैसे आप भी अभी देख लो कि मम्मी को क्या हो रहा है करके.
Again, here also, the other day only I was seeing a video wherein, it was a deal wherein, they were trying to teach men about menses, there's this girl who had cycles. So, earlier the men were supposed to look away. Now it's like, ठीक है, अपना jacket दे दो, ठीक है, उसका कपड़ा खराब हुआ है, a skirt is stained. And this guy, he just gets a sweat. So now we are, at least getting into that zone where we are comfortable talking about menses. So now, since we have gotten to that zone, it will not be far off where, we'll be talking about pregnancy and we'll be talking about menopause also. So correct. I think we're already getting there.
हाँ, शुरुआत तो हो चुकी है. मेंस्ट्रुएशन तक तो पहुंच चुके हैं, मेनोपॉज तक पहुंच जाएंगे धीरे-धीरे. Oh, that is such a wonderful, and best part, like today's whatever the time we discussed, and it's been 1 hour, we didn't realize कि 1 घंटा हो चुका है. It's 12:54 already. Best part, like discussing about you, आप problem बता रहे हो और उसका solution भी वहीं के वहीं बता रहे हो, and in such a easy way you are explaining such a big problems. यही अगर आप PubMed में जाके रिसर्च करके डाउनलोड करके पढ़ते हो तो कितना कॉम्प्लिकेटेड लगेगा, लेकिन सेम थिंग व्हेन यू आर एक्सप्लेनिंग, ऐसे लग रहा है कि हाँ ऐसा है होता है, हमने सुना है और अच्छा ऐसा करना होता है करके. सो दैट्स, आई थिंक दैट्स द बेस्ट पार्ट अबाउट यू, एंड आई थिंक इट्स देयर सिंस 1996 से लेके अब तक सेम है. तब भी आप मुझे उसी सिंप्लिसिटी से समझा रहे थे लाइफ के प्रॉब्लम, और आज वी आर डिस्कसिंग अबाउट सच अ बिग थिंग फॉर सो मेनी पीपल, एंड आई एम श्योर दैट they are understanding because you simplify it so nicely. That's the best part about you. So that I'm so happy that we are discussing this. Thanks for Sunday ko itna अच्छे से बता के, and your beautiful smile, and you look so beautiful every time, and thank you so much for this.
Thank you so much. Thank you for inviting me, Smita.